Welcome back to New Day. A drug being called Viagra for women just moved one step closer to your pharmacy. Could the little pink pill change women's and men's lives? Let's ask Elizabeth Cohen. She's CNN's senior medical correspondent, and Dr. Laura Berman. She's a clinical professor of OBGYN and psychiatry at Feinberg School of Medicine. Dr. Berman was a paid consultant to the drug's manufacturer early in the process, but no longer serves in that capacity. Ladies, great to have you here.
Good to be here.
Female Viagra, Dr. Berman, how does this work?
Well, it doesn't work like Viagra. Viagra basically facilitates, it helps with blood flow. This medication works centrally on the brain with norepinephrine and dopamine are the two key kind of neurochemicals that play a role in desire, and it kind of boosts those and suppresses the neurochemicals that suppress desire. So that's how it's believed to work. But in long-term clinical trials that the company has been doing, this company and the company before them that they bought this medication from, there's years of data. I think 11,000 women have been studied at this point, and it's proving to look pretty effective for supporting sexual desire in women.
So fascinating, Elizabeth.
Which affects 30%.
Okay, 30% of women. You and I were talking earlier, Elizabeth, about how, you know, a woman's sexual organ is often her brain. And so this pill, does it operate like an antidepressant?
You know, in some ways it works on some of the same mood chemicals, Allison. So Dr. Berman mentioned serotonin and norepinephrine and dopamine. And so those are mood chemicals. And so it makes a woman sort of more in the mood to have sex. But I want to make it clear, it didn't work a whole lot better than placebo in some ways. So when you're looking at increasing desire, this pill increased it by 53%. A placebo increased desire by 37%. So is it better than placebo? Absolutely. But we don't want anyone to think that this is a female Viagra in that it is going to be necessarily as blockbuster of a drug as Viagra was.
Right, or that it's going to work every single time. And Dr. Berman, I mean, that speaks to, is it worth it? Because this drug twice tried to pass the FDA and was denied because of side effects. So what are the dangers?
Well, I think it's arguable that it got denied because of side effects. I think that may be true. I think it had a lot more to do with politics than anything else. But it's not going to be, nothing, quite frankly, is going to be a panacea for women. We are just too darn complicated, which is a blessing and a curse. So there's never going to be a pill that women can take that is going to jumpstart every libido or fix every sex life. There's never going to be a pill that is going to be as universally, almost universally effective as Viagra, Cialis, Levitra, those medications have been for men. But there is a large proportion of women in this country who feel good about themselves, their bodies, and the person they're with, and still have no sexual desire. And this isn't because of emotional and relationship factors. And those women are really going to benefit. So will it be the same huge pool of the female population that has been able to benefit in the male population from Viagra? Probably not. But this is going to help many, many women not only improve their desire, but in my opinion, more importantly, or as importantly, improve their relationships and get a public conversation started about female sexual health that really has been sorely missing, in my opinion.
Dr. Berman, I want to stick with you for one more second because you do treat patients. Do you see a big demand for something like this?
Huge demand. As I was saying earlier, 30% of women under the age of 59 have struggle with low desire. It's the most common sexual function complaint. And there are emotional reasons for that, relationship reasons for that, and medical reasons for that. And so you have to look at the whole picture puzzle of the woman's life. And the doctor's absolutely right that our main sexual organ for all of us is between our ears. But it's a huge issue that affects women's quality of life. And in order for a woman to be considered to have hypoactive sexual desire disorder, which is the diagnosis for which this medication will be indicated, it has to be something that causes her personal distress. And that's what they're seeing the significant improvement in when they're treating these women in the clinical trials, not only in desire, but in increase in distress over how the low desire is affecting their lives and relationships.
Elizabeth, I was reading that this is designed for premenopausal women. What's wrong? Can women in their later 50s and 60s and 70s not take this?
You know, they didn't try it fully on postmenopausal women, so they just don't know. And, you know, what often happens with drugs is they're approved for one age group, but then once they're out on the market, if a 60-year-old woman wants to take it and goes to her doctor, my guess is that doctor would probably prescribe it, see if it works.
All right, Dr. Laura Berman, Elizabeth Cohen, we are starting the conversation. Great to talk to you guys this morning.